Dalawa na lang naman yun. You can...
On behalf of the Office of the Chief Dental Surgeon Navy and the Armed Forces of the Philippines Dental Chapter, kasama na rin po ang University of the Philippines Dental Alumni Association at UP College of Dentistry. Welcome to TIT Talk 2, Tayo Naman, a mental health talk for dental professionals. Kami po ay nagagalak na makasama kayo ngayong gabi sa kabila po na nangyayari sa ating bansa dahil sa pandemya. Nagkakaisa po tayo lahat sa kagustuhan na magserbisyo sa mamamayang Pilipino. Maganda po ang ating usapan ngayong gabi at papanahon. Kaya taos-puso po ako nagpapasalamat kay Dr. Sison sa pakikipagtulungan niya at sa pagkakataong binigay niya sa ating ngayong gabi. Maraming salamat din sa pakikipagtulungan ni na Dr. Rochelle Javier at Dean Danilo Magtanong, Dean ng College of Dentistry. Maraming salamat po, ma'am and sir. I hope masundan pa ito. Then maraming salamat din sa hepe ng Armed Forces of the Philippines, kay Brigadier General Angelica Torres. Ma'am, maraming salamat sa suporta niyo. Just enjoy listening. Mabuhay ang UP Dental Alumni Association. Mabuhay ang Dental Surgeon Navy. Mabuhay ang mga dentistang Pilipino. Tayo naman.
Okay, magandang gabi. Good evening, everyone. Colleagues in the professions and also partners in the industry, the hygienists, kung meron ditong dental technologies. And especially colleagues in the training or the academy of the different dental schools. I'd like to welcome you on behalf of the College of Dentistry of the University of the Philippines, Manila, in cooperation and in concurrence with the UP Dental Alumni Association and also the Office of the Dental Surgeon, Chief Dental Surgeon Navy, Philippine Navy, Colonel Benjamin Idasida, and of course our guest resource person, guest speaker, Dr. Gia Sison. I would like to welcome you all. Uh, this is part and parcel of what the University of the Philippines College of Dentistry is mandated to do to continue on our mandate and also continue serving the people. Congratulations. This is the second on a series of this kind, and I'm so happy that the UP Dental Alumni Association, through the leadership of Dr. Rochelle Javier, have been very active and very persistent in coming up with these things. I hope we can all benefit from this. We all know, needless to say, that the level of anxiety and stress is really heightened among us and also with our students and in fact all the people around us. So let's just help each other combat this health emergency, and we can only do that if we ourselves are equipped with a good health as well physically and as well as mentally or psychologically. So welcome everyone. Again, congratulations. I hope that this uh, activities will be not the end of activities, especially with on the side of the AFP and also the Philippine Navy. Thank you very much and welcome again. I will now call Dr. Rochelle Javier, President of the UPDAA.
In behalf of our partners, the UP College of Dentistry, the Office of the Chief of Dental Surgery, Philippine Navy, and the Board of Directors and Officers of the UP Dental Alumni Association, welcome colleagues and dental professionals. Thank you for joining us this evening. Our main speaker for tonight is a medical doctor by profession. She's a breast cancer survivor and a mental health advocate. She graduated Doctor of Medicine from the University of Santo Tomas, took her master's in occupational health from the University of the Philippines, Manila, and specialized in occupational medicine from the University of Illinois, Chicago School of Public Health and Hygiene. As a health leader, she served as the National Secretary for the Philippine College of Occupational Medicine and board member of the Philippine Medical Association, Committee on Continuing Medical Education. She was a former consultant to the World Health Organization and the International Labor Organization for the Global Practice of Occupational Health. Currently, she's the head of the Women's Wellness Center at the Makati Medical Center. As an advocate, our speaker serves as the first Philippine leader of Livestrong Foundation, an international NGO that aims to improve the lives of people affected by cancer. She is also the national advisor of the Youth for Mental Health Coalition, an NGO composed of youth advocates who aim to improve the Philippine mental health situation. She's a strong advocate for mental health in the workplace and currently works with companies to improve the wellness of workers. As a media personality, she regularly appears on Boys Night Out, Magic 89.9, and hosts a web series called G Talks on CNN Philippines. She writes and updates her blog, tanandstone at chiaseason.com. Friends, it is with gladness that I present to you a former schoolmate, a friend, She's a survivor and a brave warrior, Dr. Gia Bakiran Sison. Good evening, Dr. G.
Hi, Rochelle. Thank you for inviting me once again. Dean Magtangog and the rest of the panel, thank you. So I'll just share my screen. Okay, can you see my screen, Rochelle? Okay.
Yes.
Okay, so tonight we'll be talking about, I'll just be giving a short talk and then the rest yung conversation natin. The topic for Teeth Talks 2 is about strengthening coping mechanisms in a time of pandemic. Lalo na ngayon, we are already, when we look at the SAMSA phases of a disaster, we are actually on the phase of the disillusionment phase where we start to recover, where we start to rebuild and move forward. So in this talk, ang pinaka-focus po natin will be the actual steps on how to cope and eventually not lose hope, no, despite everything. So these are actually the main major concerns that we've been getting in terms of how mental health is in a time of pandemic. Madami pa po ito, but these are the top 5 na napapansin po namin. Although just a disclaimer that wala pa pong outright study that really would look at the long-term effect of a pandemic. But amongst a variety of emotions, lahat po, no, we have been feeling that uncertainty about the future. Ano yung mangyayari sa practice natin? What will happen tomorrow? There is always that lingering anxiety for now. Some of us have actually lost a loved one. Like personally po, I have lost an uncle because of COVID. However, he had to be cremated within 12 hours as mandated. Yun po, no? That's also one painful part. And of course, we are all adjusting. Hindi ko na po tatawaging new normal because this is actually our lifestyle now. We really have to transition to that. And all our emotions are heightened. We really, parang may extra feels talaga, especially now. And of course, as individuals in the medical and the health services industry, we are already feeling yung barriers in being able to access services. So ito naman po yung mga non-COVID related cases also. So may challenges na rin po doon. So that in itself is contributory doon sa ating state of mental health in a time of pandemic. And so we're all stressed out, but actually stressors are dito sa slide. It may be negative events or positive life changes. So even in the definition of stressors, it kind of balanced in a way na it may be negative, but it led to something that can actually make us better. And it will always require that skill called coping. Now, to your right is the definition of health as defined by WHO. It's not just the physical health, hindi lang biologic, even psychologic and the social part, we have to look at that. And so we talk about coping kasi yan po yung importanteng part in terms of moving forward from this pandemic. And the first step in any coping mechanism will be the acknowledgement. Acknowledgement that something went wrong, acknowledgement that something is wrong, and that we need to do something about it. And so how do we go about coping? Active coping requires acknowledgement. No? The next slide will actually show the VUCA world. The VUCA world, I'll explain it na lang po later, is actually the external factors that affect the way we are and how we will cope. It will entail being able to name our emotions. Are we angry? Are we anxious? To actually acknowledge the way you feel and analyze along the way. Bakit ako nagkakaganito? It's like analyzing your thought patterns on what is going on Pero itong part na to, what's going on from within. And of course, in coping and in the process of acknowledgement, hindi po pwede mawala yung feedback rin from others, from the people that we trust. And so we talked about, and I mentioned about VUCA. Now, what is VUCA? VUCA is a shortcut of volatility, uncertainty, complexity, and ambiguity. It actually captures the experience of operating in complex environments. Picture yourself in the middle, and all these factors are surrounding us. So, nandyan yung, of course, from the word itself, volatility refers to the speed, kung gaano kabilis nangyari ang mga pangyayari. No? In fact, that's how COVID was. It was fast. It hit us. Before the lockdown, we weren't expecting it. We were taken by surprise. In fact, I always ask myself, what was the last thing bad that I did before the lockdown? So that's how volatile the external factors can be. And thus, how do we address volatility? No? Based on studies, we can counter volatility by having a vision, having goals. Kahit na ano mangyari, ma-shake man, it's still gonna be there. The next is uncertainty, just like what's happening now, where there are no concrete trends or patterns, paiba-iba. Even the numbers it's also paiba-iba. And it makes it really very extra difficult to establish what will be the next move and saan natin mababase yung decision. And so in uncertainty, we meet uncertainty with, I would say, understanding. Of course, we all want clarity, but understanding the patterns can also help. Complexity describes the different states a system can get into at a certain point in time, which is from the word complex, madaming factors ang nagsistep in. And so how do we actually practice coping in complexity? We actually react to complexity with clarity. Hindi man tayo certain, but at least in terms of communication, in terms of the risk protocols, we have to be clear about that. Just at least para lang ma-address yung component ng uncertainty and the complexity of the situation. And last in VUCA is ambiguity. Now, ambiguity describes a situation na madaming, there are multiple interpretations that are permitted and actually valid. So, madami siyang pinapresent sa atin and they may seem all feasible, no? Madaming different perspectives. However, it can actually complicate yung ating feelings. And so, we fight ambiguity with agility. So, that is part of the coping process. This is an important concept in terms of coping in times of uncertainty. Now, the one question also that we need to answer and understand is, are our basic needs actually met? Because I'm sure lahat po tayo, way back sa school and even up to now, we are aware of the hierarchy of needs. Kung hindi po natin ma-meet yung bottom of the pyramid, it's not gonna be feasible for us. So we have to ensure that our basic needs are first met, then we go up until the self-fulfillment needs. Hindi po tayo pwede mag-shortcut, no? So I think the first thing that we have to ask ourselves in the process of being able to cope is that question, are my basic needs actually being met? And in that basic needs are the psychological needs also. And that's social connectiveness. That's why ang ina-advocate lang naman po sa COVID, it's physical distancing. But the social component shouldn't be gone. In fact, it should be stronger because of the need for each other to be able to move on. Based on a study, this chart or this graph was actually a result of a study made in Harvard in terms of emotion management, in terms of resiliency, building resiliency and being able to manage stress. Now, after that study, which was emotion management, they found out that the more you express your feelings, the more you will, the easier, for lack of, the easier it becomes to overcome it. Because constant attempts to control our emotions amplifies it the more. So yung graph sa baba, yan yung mga individuals who tend to numb their emotions, who tend to cannot deny themselves of that feeling. So this study just says that the more you express it, the more you acknowledge it, the better you will cope. And number 2 point in terms of coping is to be able to reduce ano ba yung stimulus na nagkukos sa akin ng stress. And for this game is actually common po sa time namin. I guess you can relate to, may game kasi na Tetris. Now, dun sa Tetris, there are falling blocks na kailangan i-fit doon sa baba. So I'll make you choose, no? Just type it in the chat box. For you, which is more difficult to manage, the one to your left or the one on your right. So choose lang. Basta ang principle ng Tetris, that's why it's included dito sa talk, is that the more complex and the more overwhelmed we become, the more difficult it is to cope. So it kind of teaches us to compartmentalize also and prioritize yung pinaka-need natin sa ngayon. And so coping also entails mindful dissociation. Ito naman is, because it's not also good if we are constantly exposed to negativity. Hindi natin maiiwasan, yes, but constant exposure is actually damaging to our mental health. And so dito papasok yung mindful dissociation. This is where stories of hope is needed. Exposure to situations that actually spark joy, if I may use it. Sabi nga ni Marie Kondo, no, in Netflix, it's really finding hope in something that seems to be so magulo siya. So that's mindful dissociation. In fact, it's an everyday decision we make to be able to move forward. And of course, hindi po maiiwasan that nowadays, social media can be toxic. And so our mental health may be affected by that. And so what do we do? So we really have to limit our notifications kasi pwede naman yun. If an app gets too toxic, you can just leave kasi may mga discussions that get into you that affects us. We also have to regulate that. And one tip is also get our information from credible sources. Madami na po kasing mga, chat platforms that are actually venues for fake news. And that actually triggers, mas nati-trigger po tayo. So let's balance it, no? Balance ourselves with negative news na hindi naman natin maiiwasan. But balance it with also stories of hope, positive news on the other hand. And regulate your exposure. Number 3 is try to reframe your thoughts, our thoughts, in the ability to cope. Evaluate yung thought patterns whenever something hits you. And these 5 questions can actually help all of us in terms of evaluating paano nga ba tayo nag-iisip given a scenario like COVID, or any situation that actually triggers feelings of anxiety or bothers us. Number 1, is this message really true? Am I actually telling myself that this is true? 2, would the person say this to another person? This is in terms of feedback. 3, if not, why am I saying it to myself? Number 4, what do I get out of thinking this thought? And then lastly, if it makes me feel badly about myself, why can't I stop thinking about it? So these are actual, parang it's a recalibration kung paano talaga natin pinaprocess the things that we tell ourselves and the experiences that we have. Brene Brown is actually one of my icons in terms of promotion of being vulnerable and open to feedback. In fact, I mentioned feedback earlier na that's part of coping. And in terms of feedback, she mentioned that I just highlighted it here. You can't take criticism and feedback from people who aren't being brave with their lives. So in getting feedback, we have to ensure that kukunin natin from someone who really actually underwent it. Hindi lang yung someone who actually who walked the talk. So something like that. So ito naman is kasi we talked about thought patterns, and we want to shift ourselves to more of that reinforcing positive scripting. Positive scripting is more of replacing a negative thought with something that is hopeful whenever you start to realize na, Eps, I think I'm getting too pessimistic about it. It's not to invalidate pessimistic thoughts. In fact, nature natin yan, it is actually a defense. However, when you always dwell in a negative thought, it can affect us negatively as well. And so you start to shift it into a hopeful thought. And repeat it, affirm yourself every now and then. If you are the type of person na palasulat, then write it down. Those are called visual cues para lang ma-remind tayo that things will get better. In fact, in my table, I have that small saying that, yes, things will get better, because there are really days that I personally feel hopeless. Being also in the medical field, everything seems to be uncertain. And making signs that say the positive thought, hanging them, yun nga, putting them in places that you can actually see. And it actually works. And lahat tayo, we had plans, no? Early 2020. In fact, we're already in nasa July. It's already July, and half of the year, I'm sure all of our plans have shifted. And so we have plan C's na. In fact, diba, plan D, plan E. So at this point in our lives, we really need to anticipate various outcomes, no, given the scenarios, rehearse it, and develop clear plans also about it. Kasi we all know it's already uncertain. The least that we need is something uncertain pa sa ating mga buhay. And so we start to plan. And we're talking about feasible and realistic plans. So this is actually part of coping, no? Adjusting expectations and plans. And fourth is practicing self-care, which we oftentimes forget. Kasi in the medical field, in the health field, we're always thinking of others. But in the process, we sometimes lose that reality that we can't really take care of others kung hindi tayo well ourselves. And so we practice self-care. And this is really, if there's one thing I want to leave you, there's really no one-size-fits-all plan when it comes to self-care. Individualized ang plano when it comes to self-care. My type of self-care may not work for others, but we have to respect that. No? And in addressing how you can apply self-care in your life, it will, based on the UN Development Program, these are the 3 steps in being able to determine what is best for you. No? Whenever you reflect, you examine, and you replace. Reflect means, kumusta ba ang coping strategies natin ngayon? Nangyari na ba to before? Probably merong nag-work before that we can apply now and just add extra. Examine also, ano ba yung mga barriers that naghihinder sa self-care sa sarili? And lastly, replace it. Replace a negative coping to something that is positive. A typical example is, kunyari, pag nagagalit ka, we tend to say hurtful words. But instead of doing that, my personal practice is to pause and count till 10, hoping that I can hold that negative emotion and just turn it into something positive. So reflect, examine, replace is actually a method of self-care that we can all do. And there are different types of self-care. There's physical, emotional, social, and spiritual. And for me, setting boundaries is very important also. Hindi lahat ng sitwasyon we say yes to. Paulo Coelho actually describes self-care in a very nice way. No? Sabi niya, self-care is actually saying no to the usual things we say yes to. So self-care is a deliberate choice we make every day. Focus on prevention, build it into your daily life, and make it a habit. And amp it up, especially in these stressful times. Remember, self-care isn't always about pampering oneself. Most of the time, it's really about doing the painful things that ultimately do you good. Yun nga, no? We're not, basically, hindi tayo no people, but self-care is sometimes saying no na. And of course, lastly, building hope. No? Whenever we cope from something that's very tragic or has really affected us, we tend to slide back. Minsan may days rin talaga tayo na parang we all say wala ng pag-asa. But still, we try to always build hope. No? Never lose anchor on that. Remember, hope is required to anchor to a better and a just future, if I may add. You may want to have an alternative view on the situation, recognize the progress that you make. No progress is too small, and active imagination on what you want to happen. So we have to remember that. This is my last slide. We have to remember that our future is not cast in stone. There's a future that we're facing that we can actually collectively shape and build. So let's anchor on that. And so to summarize yung previous slides, how to strengthen our coping mechanisms. First, we acknowledge how we feel. Then we mindfully dissociate from the things that don't work for us, that make us feel toxic. We reframe our thoughts. We build on more optimistic thought patterns. Amp up on self-care, because we cannot care for people if we're not well ourselves. And again, anchor on hope that things can get better. So that ends my slide. Back to you, Rochelle. Thank you.
Thank you, Doc Gia. That was very helpful tips for everybody. But then we'll go now to the next portion. We have some panelists with us today. First, let me introduce my co-moderator panelist. He is from UP College of Dentistry, batch 2012, and he is a faculty in UP College of Dentistry and Oral Medicine. He is also the Assistant Secretary in UPDAA, and he has been in practice for 8 years. Friends, Dr. Marc Pilaspilas. Hi, Marc.
Hi, Dr. Monica. Thank you for that introduction. So for our audiences tonight, thank you as well for being here, for joining our online discussion on mental health. And let me just introduce my co-moderator and co-panelist, Dr. Monica Sison Quiambao. She is from UPCD batch 1997. She is currently the Vice President of the UP Dental Alumni Association and is presently in private practice, specializing in orthodontics.
Yes, good evening. And let's also introduce the rest of the panel. First would be also an alumni of the UP College of Dentistry in 1982. She was the chair of the Board of Dentistry in 2003, a former president of ESP, Quezon City Dental Society, ADI, and ICD, and has been in private practice for more than 25 years. Friends, Dr. Chico Achacoso Damatac. Hi, ma'am. And so also our next panelist from our special guests tonight from the Armed Forces. He is also a graduate of UP College of Dentistry in 1992, and he is presently a student of Master in National Security Administration, Colonel Isidro Alex Urriquia. Mark, can you introduce the rest, please?
Well, we also have for tonight, we have Dr. Tristan Ramos, a father of two, one boy and one girl, 21 and 18 years old respectively. He is from batch 1993 of UPCD. He was also my professor in Prosto and is the faculty of prosthodontics at the UP College of Dentistry. Please welcome Dr. Tristan Ramos. And we also have Dr. Ian Ermita, a father of five, two boys ages 18 and 16, as well as three girls ages 15, 13, and 4. He is from batch 1994 of the UP College of Dentistry. He was also my professor in oral medicine. He has been in private practice for 20 years. Good evening, Sir Ian.
Good evening, everyone. Thank
Good
you.
evening, everybody. So let's start the panel discussion. So for me, like when they first announced that there will be a lockdown, 2 weeks, stay at home. Yes, I can do that. But when they extended it a bit more, and then they're going to say that the dentists are the most vulnerable to COVID. So that's when the anxieties or the worries started to come in, right? How about you, Dr.
Yes, Dr. Monica. Uh, uh, I have to be honest about it. When the news started, I thought it was just going to be a minor inconvenience for us. But then as I was watching the news, it turns out it's something else entirely. Because remember, we've had MERS-CoV outbreaks, we've had Ebola outbreaks, and nothing of those was like this. So I guess in the profession now, especially for dental professionals, is that there's this uncertainty as to what's coming next. Um, Specifically for those who are relatively new in the profession, please remember that we have only started being in the practice of dentistry. Some of us are opening our clinics. Some of us are starting with our postgraduate studies or maybe finishing our postgraduate studies. It's difficult to visualize what's going to happen next. And even if some of my colleagues, they say that when they consult their senior dentists, there's also that uncertainty. So maybe we can talk about more. Maybe we can dissect the reason for this uncertainty, and maybe we can get a bit more clarity, like what Dr. Gia said. Dr. Gia said earlier. Does anyone from the panel have something to say or advice to the younger generation dentists about this uncertainty we are facing?
Or maybe Doc Gia can start.
Well, you know what, Mark, I can relate now because we are all on the same health field, no? Lahat tayo affected. And yes, I have seen the most vulnerable specialties, no? And dentistry is one. But I guess yun nga, no, sinabi ko kanina, yung acknowledgement ng uncertainty, that's actually part of being able to cope. And then I have already, sometimes yung mindset ng making do with what you have now, it actually also helps. Yes, may postpone dreams that actually happened, but it doesn't mean that it's totally canceled. And then one thing we also do is to prepare. Some doctors have actually went back to practice, and it's like rebuilding it all over again. But I think with the pandemic, building up on the health and safety protocols and making sure that we are protected, is actually the first step in being able to get back to practice. So, yun, I'm speaking from a practice standpoint kasi I myself, I'm at high risk if I further expose myself. And yun, I just wanna say that postponed dreams doesn't mean canceled dreams. No? We can still pursue. It will take time, but it doesn't mean that it will happen. And so we start to rebuild one at a time.
Yes, thank you, Dr. Gia. Also, since I'm representing the sentiments and the concerns of the younger generation dentists po, I would just like to ask, is it the case that the younger generation, not necessarily dentists or of any profession, but is it the case that the younger generation, for the younger generation, the terms anxiety and depression are overused? Or is there evidence to suggest that for the younger generations are really more predilected to having these mental health issues?
As we speak, we don't really have evidence yet in terms of that younger people have higher chances of having mental health conditions. However, may observe the rise lang dun sa numbers because of, I would say, greater acceptance and knowledge now, no? Especially nung na-sign off yung mental health law. And all these are valid. Everything is valid. It just amplified that mental health feelings are real. Mental health challenges are there. And I think it's more greater exposure. No? Children are more exposed also to mas higher yung expectations eh. Ay, parang ewan ko Mark, no? Pero I think yun yung concern na common sa akin yung there's that higher level of expectation from society, from family, if I may say. And they receive information faster eh. I hate to compare, but yun lang. No? But it's really a pattern though. But again, all feelings are valid. I would always take it off from there.
Yes, Dr. Gia, thank you. Especially coming from faculty, sometimes you are also worried that students might be using depression or anxiety as a scapegoat for non-performance. So thank you for clarifying that up po. Dr. Monica?
Yes. Since you were talking about exposure, a lot of exposure has come to the armed forces. Can I ask the Colonel Urriquia?
Yes.
You may ask your question, sir.
Doc Dia, good evening.
Good evening po.
How can you detect if someone is having mental health issues, especially in our workplace where most of the military personnel cannot go home to their families during this pandemic?
Colonel, it will help if you have, kasi usually po, makikita nyo yan sa behavior. There's deviance in behavior, merong dysfunction factor, parang affected na yung quality of their lives. And so, makikita nyo yan sa pattern, no? Kung yung mga dating outgoing, tapos biglang may signs ng isolation, maybe, no? That can be one sign na nagsasuffer, nagde-decline yung mental health. And so, ang advice po namin is to have daily kamustahan sessions. No? Yung word po kasi na kumusta kayo is very powerful. In fact, it can actually open a lot of issues. So, yun po. We can start from there kasi yun rin po yung pinaka-common na pattern eh. May change in behavior, may deviance, wag naman po sana umabot sa nagiging may harm na rin to others, yung ganon. So we have to be extra sensitive with that.
Thank you, Doc. Another question. Can you say that alcohol is drinking alcohol, especially in camps? Do you consider it when do you consider the alcohol intake abnormal already? As a coping mechanism.
Okay. If it's already coming to a point na dependent yung behavior, it has parang hinahanap na. And it cannot you can't function without it anymore. So yun po, that's not for me. Pero bawal po talaga. Colonel talaga. So yun po, kung parang hinahanap ka na.
Your part a little bit too broad, no?
Yes, but if it becomes already a run to, you're dependent on it to be able to function well, that will be the start already, I must say. Although I'm not a psychiatrist,
But can you consider,
yes po.
because you said a while ago na kumustahan.
Yes po.
So what if yung kumustahan happens during light drinking session?
Ako, si Kern. Well, okay naman po, no? It's every now and then, now we need to, kung social drinking, that's okay. But we really don't condone the addiction. That's the side, that's the downside of it.
Yes. Thank you.
Thank you, Colonel.
Doc G.
Yes, Rochelle.
I'd like to add lang to the question of Colonel. There was also a question submitted pre-registration. So if the worker seems extra anxious, what is the best way to approach? Do you tell her, oh, I think you're depressed, you need to go for counseling? And how do you actually tell the person? I guess gently. And then yung sa alcohol, baka si Dr. Ramos can assist Colonel.
Yeah, actually, magsasalita nga sana ako. Sabi ko sana sasama ako dun sa session. Pero joke lang.
Parang Tristan nung college.
Oo, noon lang. No. Outlet talaga yan no? Alex. No? Outlet yan.
Ayan na.
Kami magkakasama
hindi naman siguro na naging dependent tayo. No? Ano lang talaga.
Wala talaga, wala.
Yeah, it was something that was enjoyable then. No? And I think from time to time, rin naman, it helps. Especially if you're in good company. Ayan. But I would like to say something about yung earlier, yung na-mention ni Dr. G about yung anxiety and going back to work, yung preparation. No? Mahirap talaga. Like, for example, me being here in UP Manila as an administrator, as a faculty member, lalo na dentistry, yung high risk. No? Sometimes, you can't help but think na, how do I prepare? Is the preparation really enough? And being an administrator, yung iisipin mo pa yung welfare ng mga staff under you and the students, of course. Have you done everything to make them safe in the workplace, etc. Sometimes it actually bugs you until the time you sleep, no? Iniisip mo 'yan as an administrator. I think also as dentists, no, especially with us who have practices now, we actually employ some dentists also and hygienists or any other. Sometimes minsan naiisip natin 'yan, no? And I think it actually takes a toll on us. And I guess that's really good that we need to do that, yung preparation, making everything safe and making everything okay with all of the stakeholders. Kaya lang yun, Dr. G, no, mahirap din eh. Sometimes when you sleep before you sleep at night, naiisip mo, and then sometimes even if you think positive things, talagang it actually recurs. No? Do you think it's just okay? Yung sometimes medyo naiisip mo yun, minsan medyo natotrouble yung sleeping habits mo, yung mga ganon. Is that okay? Basta lang, nakakatulog ka naman and you wake up and then you function the next day. Okay lang ba yun? Or meron dapat gawin for instances like that?
Actually, Doc, we're really all expected to have that anxiety. It's really a normal reaction kasi nga it's something that's very new when it hit us, and it's something that wala pang pattern. It's really wild. Kumbaga parang it hit us by surprise. And so as medical professionals, yung talagang battle gear natin will really be all about safety and ensuring that we are protected too. In fact, to be honest po, I asked my friend because I need to see a dentist. Pero there's a certain protocol that I have to follow. Na parang, and that's already gonna be the new behavior in terms of health. Before you can see a dentist or a doctor, talagang kailangan may screening. And the anxiety, the toll will really have its take on us. So talking about it, Doc, is actually helpful. When you talk to your staff regularly, o ito yung plano natin, actually having a stringent health and safety protocol actually reduces it by, I can say by 20% man lang. At least alam ko na may ginagawa yung clinic about it, yung institution. So, yun po. I think making do with what we have now, we just have to live with it one day at a time. Kasi masyado tayo magiging overwhelmed.
Dr. Tristan, anything else?
Siguro later I'll ano. But for now it's napasingit lang talaga ako dun sa alcohol
Doc G, nang answer yung how does she tell her workmate
Okay.
depressed or something, need counseling?
Actually, Rochelle, you don't really force people to talk about it. No, the best move, the first move is to really ask how the person is, and then kung hindi siya magsalita, respect the silence because not everyone will be ready immediately to share. So, assure lang the person that you're there anytime na kailangan niya ng, listening ear or somebody who he or she can talk to. But that's the number one rule, no? Never force someone to talk unless meron ng elements of self-harm, suicidal ideations. That's something else. But I think just being there to listen is already helpful.
Thank you. Is there a particular comfort zone that you can actually ask a person?
Okay, dito papasok yung element ng trust. No? If you're already at a level of a safe space, trust mo naman yung tao, then I think you can open up. It really depends rin kasi sa environment and how your relationship is as friends or as colleagues. If there is a high level of trust and safe space naman siya, then the chances of that person opening up will be high. That's why we encourage workplaces, communities to establish that level of safe space na pwedeng magsalita yung tao na hindi siya ma-judge. So let's start from there also. So, yun.
Thank you, Doc G. We'd like to encourage everybody to write their questions here in Zoom. So, Doc G, we will be able to tackle it in the next half of the discussion. Mon, thank you, G.
Yes, in relation to that, because if there has to be a level of trust, the person that I really need to talk to is my 10-year-old daughter. But then she's just one child. And she's an only child, so she's used to being alone. Doc Ian, you're the one with the most children here.
Yeah, I was gonna, ask nga Dr. Gia, because being a father, 5 kids, but actually, one thing that I observed was there was an advantage for having 5 kids because they sort of take care of each other, entertain each other. I was gonna ask Dr. Gia how actually how I can detect if they're having mental health issues in kids. What are the signs that I have to look out for? Because as a father, I'm actually more worried about the effect of the lockdown on my kids rather than myself.
Yeah, Doc, it's really part of yung parental instincts natin. But one pattern that we need to see is pag nagre-regress sila sa behavior before. Kunyari, the child is already 12, but mukhang nagre-regress siya sa attitudes niya when she or he was 7. That can be a sign. Although, hindi ako child psychologist, but that's a very common parang lesson I get from my colleagues who are on that field. Pag nagre-regress in behavior, yun daw yung mga things to watch out for, red flags. And isolation is one Kung parang parang kung dati very open, tapos biglang may change of behavior, that's also one area na pwede, no? Possible. That's why it's very important that social media is controlled, because that's a very potent weapon, if I may speak, in many ways. It has its good side, it has its bad side. That's why it's important that we're there for them despite the lockdown and our own issues also.
Yeah. Thank you, Dr. G. Actually, well, just wanted to share some positive things that I found in this almost 4 months now of lockdown. We don't include the June. Actually, this gave more time for us as a family to be there, to be around each other, and actually, to be honest, one of the things that positive things is this is actually the time that we had time to pray as a family almost every night actually, since I don't think we could have done that if it's during the lockdown. But you mentioned earlier, you have to have that anchor, you know. So I think one of the things that really gives us that anchor is our faith in God. So I think that's one thing that I can actually also share with the rest of us as we try to deal with this pandemic, no? And with all the uncertainty, as you already mentioned, really a challenge to get through. But as you said, just one day at a time, and we can all get through this together.
Yes, that's true. Yeah, one day at a time is very effective. Kasi the more, although we have to plan, pero we have to make do with what we have. So, mahirap yung balance, but we need to do it. We need to start doing it.
And we'll now go to one of our senior panelists, Dr. Chico. I know you have some questions.
Okay. Yes. Thank you, Dr. Gia, for spending time with us. You know, for us, the seniors, actually, at the beginning of the lockdown, I was really enjoying it. I mean, it was like, wow, heaven, because it was a forced vacation. And finally, when they were easing it down, I mean, when they were opening up already, and I knew I had to face reality, that's when I think I started getting anxiety attacks already. And so I'm hypertensive, and I know a lot of people my age are already taking a lot of maintenance drugs. So would you say that this situation can actually wreak so much havoc in our system that we probably have to see our cardiologist for adjustments in medications or whatever? Or is this something that you know, we can just cope on our own?
Well, Doctora, yes. In fact, it's an indirect cause for rises in blood pressure kasi stress na tayo eh. Because I myself, I also have my comorbids. And I think we have to take advantage of the teleconsults, no, because it can affect. We still continue our medications, but it can take a toll on our physical health. May study last 2014 that I remember that there's really an effect of stress sa heart rate. May ganon. So, ang advice ko po is really to still be vigilant in terms of the follow-up and try ways that can relax you. In fact, do the things that make you happy para mag-increase yung endorphins, Doctora. So, that's my take on that. And that's also how I personally deal with my own struggles.
I think earlier on, Dr. Tristan mentioned something about sleep. You know, we know sleep is very important for us, and of course, as you get older, you seem to have less time sleeping already. I mean, you know, you just wake
Yes.
up automatically after a few hours. You're up and about. sometimes you can sleep again, but then, so I was just thinking, would you recommend for us to be taking, this sleep tea, happy tea, or melatonin, or these things that can help us get more sleep?
Medications will be the last. I would say the first line will still be um, physical activity, avoiding napping above more than 4 p.m. If you're taking naps, limit it to 30 minutes. Yung sleep hygiene, Doctora, that should be followed because again, the last resort will be medications. Tea is okay, but just ensure that the tea is um, chamomile is actually study na po
Chamomile.
yung chamomile, yes. But the other tea brands kasi, some of them have caffeine. So we don't recommend that also beyond 4 p.m. to be particular kasi makaka-affect na po yan ng sleep as early as 9 p.m. So be careful also sa tea na iniinom. If you want, you can take green tea. It has less caffeine compared to black tea. So yun po, let's go the usual route. Relax, avoid screen time because when you look at your cell phone before you sleep, that actually inhibits melatonin. And so we have difficulty sleeping. And so we really advise total darkness to really have good quality sleep.
Excuse me. What about acupuncture? Because I know
Yeah.
a lot of my friends are
Yes,
undergoing that now for stress relief.
Yes,
I
po.
mean, does it really work?
Yes, po. Yes. Acupuncture has been proven po, well, it can help actually improve a lot of medical conditions po. So yes po, it can help.
And yoga?
Yes po, meditation, mindfulness, yoga, that actually, if you're really into that, kasi some also are not into so much of those practices, but it actually helps calm you down. Pero you need to practice it regularly kasi to be able to gain its benefit. So it's not a one-time thing. You really have to establish a daily routine for me time or yoga to be able to reap its benefit.
Dr.
Okay.
Gia, I've actually been doing a little bit of meditation for quite some time now, and there are benefits I am experiencing. I'm just curious as to what the actual what's going on inside, what the neuroscience is behind it, why it has the beneficial effects that it gives.
Well, it really triggers kasi the endorphin levels. It relaxes you. Hindi ko na maalala yung exact biochemistry reaction. Bumagsak ako ng biochem ng med school. So anyway, but the relaxing part of yoga is really being at the moment and the surge of the feel-good hormones. So it really helps.
You also, Dr. Gia, you also mentioned earlier yung importance of physical activity, exercise,
yes,
sports like that. I think when they relax the guidelines, I think that's, well, personally also that's what if Mark does meditation, I play tennis as my stress relief.
Yes, that's true. And in the realm of exercise, you do what's best for you. Some kasi works, they exercise at night to help them sleep, and that's okay. So we recommend morning to pump up your metabolism. Pero you really do what's best for you. So kasi I also get a lot of questions on what time is best to exercise. So some kasi can, you actually exercises before bedtime para makatulog. And that's okay.
Thank you, Dr. G.
I have some questions here on Zoom. So
Okay.
one would be, how do you handle paranoia from getting infected from others, especially in workplace and patients who enter your clinic instead of you?
I think first of all, paranoia is a diagnosis made, no, in certain criterions in psychiatry. I think I'd like to believe more of yung concern sa safety side. So how to deal with it? Just ensure that safety protocols are in place. Kumbaga parang never get into battle without a gear. So PPE is very important to be practical. If you have to change the way your clinic looks in terms of filtering, etc., although I'm not an engineer, do so kasi may mga modifications na kailangan gawin. So dito pumapasok yung health and safety protocol again as something that you prepare for. So that's my take on that. I don't think it's paranoia unless it's a diagnosis, but it's more of you're just concerned about yourself, of course, that's normal, and for others as well.
Thank you, Doc Gia. Doc Mark?
Yes, po. Dr. Gia, I have one question here. As a parent, I am anxious of the future or of the situation in general. Although as my day goes by, I seem as normal as it can be. But when everyone settles down for the evening and I go to bed, I start getting anxious and sometimes start to palpitate. I'm not hypertensive. Would it be okay to take Sleepacil or melatonin supplements?
Okay, I'm not an endorser, ha. So anyway, let's take on the non-medication route first. Deep breathing can help. Inhale 4 seconds, hold your breath for 2 or 3, then exhale for 7. Do that regularly first. But for melatonin to enter, that's also okay. Pero may limit kasi yan eh. So we don't recommend it for long-term use. So again, let's go to the non-medication route first. And if it really doesn't work, then that's the time we can consider possible aids for you to help para makatulong kahit papaano.
Thank you, Dr. Gia. Also, since we have mentioned about non-pharmacologic means of managing anxiety or depression first, Dr. Gia, what if, kasi we've been talking about it as if we are an outsider observing someone else. What if you are the one, from the perspective of the one dealing with anxiety or depression? What if, for example, po, you know that you probably need to seek help, but then you are stuck in this thought process which makes it difficult for you to seek help from others. Is there anything you can advise for these people po?
Okay. Diyan kayo magte-take off, Mark, yung feedback from others. So you may want to ask a trusted, it doesn't have to be, kasi yung definition ng family, it can extend already to friends. So you may want to get feedback from a trusted friend na, what do you think of me? Yung ganon, parang, because it can actually make you wake up to a reality na hindi mo nakikita. Now, we're all familiar with the Johari window. Diba, sa retreat, mahilig tayo paggawa ng Johari window, no, in terms of that. There's a certain part in our lives na we don't know, that we have to get feedback from others. And so that feedback will help in that type of situation.
Yes, thank you, Dr. Gia. So essentially, talking to others really will help. Tama po ba?
Yes. Never underestimate the power of talk. We call it talk therapy, the power of support. You can't really do this all by yourself. We're literally, collectively in this together. Iba-iba lang tayong levels kung paano tayo tinamaan, but everyone is affected. And so support is really important.
Yes, well, thank you, Dr. Gia. Dr. Monica?
Mon, can I, there's another question here. It's a pre-registration question. G, can we continue? You've mentioned already the melatonin and yoga. The question here is, what is the practical way for a dental professional to reduce anxiety and maintain mental well-being at the time of the pandemic? And the same question, coping with the effects of the new normal. So it's a related question, aside from those that you've mentioned.
Rochelle, sorry, I lost you during the first part. I had audio problems. So can you repeat the question?
So because you've already mentioned yoga, melatonin, meditation, they're asking for, are there other practical ways for a dental professional, siguro in between work, to reduce anxiety and maintain mental well-being in the time of the pandemic? The same breath, another questions related to that, how do they cope with the effects of the new normal? Now there's a new dentist-patient relationship.
Yeah, right. That's true. No, that's already part of our lifestyle from now on. So that's one thing to acknowledge that it's already going to be part of our practice. It's the acknowledgement, the self-awareness part also of how we feel is a big part before we start coping, because we cannot cope with something we can't accept. So I think the first step there is really to be aware of how you feel and then accept bit by bit. Now, for the other part on how to deal with, you may want to find ways in which you find, parang you're interested in. It doesn't have to be a hobby. You might want to explore new skills that you have. So, ganon, yung mga, those are the type of coping mechanisms that I can also recommend that we try to do, because it can help, actually.
G, in relation to that, there's one more question in Zoom.
Mhm.
Can overworking be considered as a coping mechanism?
It's a type of denying yourself of feeling. It's more of that. And yes, may tao talaga na dinadaan sa trabaho ang stress. And if that's the coping mechanism of an individual, I cannot question that. However, you also have to take on the side of also your physical health, because it can take its toll. So if you're working 24/7 because you're evading a problem, eventually that will also take its toll on your physical health. So you might want to again reevaluate the way you cope. Maybe it's about time you start to face it and cope in a healthy way. Yung ganon.
Thank you, G. Mon?
Thank you, Dr. Lia. That's new. Okay, so we have one more question. How do you cope with this? If I am a COVID survivor, paano ko ma-assure sa sarili ko na once bumalik ako ng practice, tapos nagka-patient ako ng positive nang dahil lang nag-visit sa clinic, na hindi siya dahil sa akin?
Okay, dyan kasi papasok, hindi talaga yung mawawala in terms of caring for a patient. Pero para sa akin kasi, once finollow mo naman yung usual health protocols in being a COVID survivor, you practice naman what should be yung safety protocols, and I don't think you can, don't put the burden so much on yourself also, as long as you did your part. It's not also all about you. We all know that you can get COVID na from anywhere. There's already new studies na, I mean, may isang aspect pa nga that you have to always act as if you have the virus para lang ma-practice mo yung mga safety protocol. But to the question of the guilt, for me, you don't put it all on yourself.
And that would apply to your staff, your family, diba?
Yes.
They're not okay. Thank you. Doc Mark, do you have any questions?
Yeah, I want to just share something
Yes,
in relation to that. Actually, diba, we were actually at home for almost 2 months, and then when it was the time to go back to work, actually when you go out, talagang parang yung paranoia, hindi mawawala eh. Pagpasok mo pa lang sa office, isipin mo na ano ba to, baka meron kaming makasalamuhan na positive, or especially here near PGH, yung mga doktor na clients namin dito sa office ng registrar, nandun sila sa window, usually sa lobby, and when you go out, makakasama mo sila, and it actually at first talagang mahirap. Hindi mo alam na kung simple, small contact with them can actually give you the disease. Tapos pag uwi mo sa bahay, nandun ang pamilya mo, nandun yung mga anak mo, ligo ka kaagad and everything. No? just to prevent that. Pero as time goes by, no, or as you go every day, nawawala eh. I think yun nga, masasanay ka dun sa new normal that we're going to face. I guess that will also be the same as when we go back to practice, as we re-engineer our offices, as long as we practice everything correctly, stick with the strict protocol of health. I guess yung anxiety unti-unting mawawala. And as from my experience, ganon talaga. Nakakatakot at first, but when you experience it every day, and then basta take care of wag ka lang talagang magbababad sa mga sa mall, sa mga kung saan man na matao. I guess it will be marireassure mo yung sarili mo na it is actually okay. Basta lang practice safe tsaka strict protocol lang yung sa health and everything.
Actually, Doc, to add to your point, remember the practice of hand washing was very underrated before.
Tama.
Pero come to think of it, when you look at the protocol on how to at least avoid or prevent COVID, hand washing is number one. So dun pa lang kasi, and to the point of Doc, that's the behavioral change that we need. We have to be more, we already have to acquire the basic, yung mga hindi na tinake for granted natin dati. Yun naman talaga yung magiging part ng lives natin. So I always take it from that angle. And let's look at it from that angle. It was a very underrated practice that turned out to be the number one prevention tool. So, yun, that's my take.
Thank you, Doc G. Dr. Tristan, we won't let you go first. There's a question here for the administrator panelists, so I guess it's for Dr. Tristan and Colonel Alex.
Yeah.
How can we address stress from working in high-risk areas with less recommended equipment or machines? And how can government dentists cope with limited and frankly unfair resources during this pandemic?
Alam mo, mahirap talaga yan no? For me, siguro, think of your safety first. Sa akin, I mean, don't go, sabi nga ni Dr. G, don't go into a battle na hindi ka prepared. Siguro, hindi siguro dapat maging martyr sa ganitong times. You want to serve, you want to function, you want to help people. But, in doing so, you have to really protect yourself all the time. So kung halimbawa, sabihin ng administrator sa'yo, sabihin ng boss mo, sige, go, treat people, pero hindi ka naman niya bibigyan ng enough protection. No? Siguro dapat pag-isipan mo rin. I guess, dapat two-way no? The administrator should listen to the staff, to the people, and give, kumbaga, bigay lahat. Hindi po pwede kasing half Hindi po pwedeng, sige, pwede na yan. Baka naman hindi ka mahawa. Hindi ganon. We have to re-engineer everything. We have to prepare everything. And we shouldn't actually make people, work na hindi maganda yung environment niya. And we don't have to put people at risk, especially as health workers. Mahirap yun kasi. Kasi paano kung tayo yung magkasakit? Diba? Mahirap din. Kasi wala na magpo-provide ng essential services. Yun ang tingin ko doon. I mean, kung ikaw yung sasabak sa gano'n, you should think twice and maybe you can suggest to have more protection rather than, sunod lang na sunod.
Sir, sa inyo, mas madali yun. But for someone like si Colonel, who
Ayan,
has orders...
Kasi, yes. So, it's different.
Paano sa inyo, sir?
On our part, the AFP has already issued a letter directive. So, it's a guidance for all the dental treatment facilities within the AFP that we should only treat emergency procedures until the conditions of COVID are certain already. So usually, non-aerosol generating procedures are usually accepted in the dental treatment facilities, and mostly since with the military, there's also the physical examination. So that's necessary procedures that we have to do. The Office of the Chief Dental Service also created an info video, which the military patients can view para alam nila on how to seek the procedures on seeking treatment with the dental treatment facility.
Colonel, thank you. There's another question for you, actually. Do consults for mental health professionals within the AFP, I guess, and visits to mental health facilities stay in their records?
Come again.
Sir, yung consults and visits to mental health professionals from the AFP, does that stay in the records?
I'm not in the position to answer that.
Okay, sir. Thank you. But that was
part of my...
Okay, sir. Baka there's someone here who can answer. Pakisagot na lang kami sa Zoom. G, thoughts on that? Yung ganong records.
For me kasi, confidentiality is very important. So that remains to be in the record. So, and for you to divulge it, it really needs patient consent. So I guess it all boils down to consent and confidentiality. Kasi para sa akin, that's part of a medical record. So pag sinabihan ka, it's like, the practice is really all about trust. So it stays with, unless may consent ng pasyente. So that's my take on that, Rochelle.
Thank you. Mon?
Also, Doc Gia, because my parents are old school, so it's for them, like, if you're somebody with mental issues, you're being branded as a lunatic or something. Those terms, can you please enlighten everybody that it's, like you said before, the anxieties is normal. Having the issues right now is normal.
Actually, lunatic was a term before, no? That's actually a misconception. And so, yes, we acknowledge that there's still that side of the spectrum who don't believe that mental health conditions exist. But that shouldn't stop us from talking about it and making them and continuing the education. Diyan papasok yung continuing sustained health education. And I have already seen also a lot of conversions of individuals who were non-believers before. Tapos, because we always talk about it, and individuals with lived conditions actually talk about it. It helped in being able to educate people who are not aware. So I think that's where education comes in not only in mental health, but in everything that we advocate for.
Thank you, Doc G. Doc Mark, do you have any questions there?
I have a question, if it's okay. Yeah, Dr. G, actually I wanted to also, sort of looking at the Filipino psyche, or like what values do you think or characteristics of the Filipino now which we can hold on to or reinforce in coping with all of this especially the uncertainty part?
Pagdating sa culture, this is my personal take. Yung yung lagi tayo bumabangon from major disasters. Yung hope talaga, resilience is a very common term, but I would say it has taken us into so many places na, and it has made us survive a lot of tragic events before. And I think that's something that we hang on to. It's really the resilience of Filipinos.
Can I ask? Um, can I ask a question
Yeah.
about because right now anybody 59 and above were being asked to stay home, right? Yung ating range for someone to be considered a senior citizen is from 60 and above.
Yes.
How come in other countries 65? 65 ang kanilang starting point, to be called a senior citizen. So, I mean, does it have anything to do with the Filipino state of mind or what? I mean, for them to put this, at such an early stage, 60 Filipinos?
Yes po. In the Philippines po, 60 years old.
Yeah, seniors na.
Part ng pwede mag-apply for a card. But I think we're taking it more on an angle of immunity level. Because parang ang extreme of ages po yan eh. Yung baby stage, so to speak, and then the elderly stage. It's more of the immune system that is weakened as we all age. So that is what we are taking care of. Especially now when COVID hits someone who is more than 65, the complications may really set in. But then again, it doesn't have to be really taken. Pero that we're coming from that level po. And yes, other countries, 65 po ang start. But dito po, it's really 60.
It's 60.
Yes po, Doctor.
Okay, thank you.
Rochelle, do you have any questions there for you?
Okay. Here they're saying that, and you actually, yeah, if you can actually, you were able to purchase all these things that they recommended, the devices, should that already give an assurance or lessen your anxiety? Yung that you buy in the dental market.
Okay, it will lessen, but nothing is 100% guaranteed. So you still have to stay strict on your safety protocol. Although syempre malaking bagay ang mga PPE, re-engineering, but still habits matter and behavior matters when it comes to this.
Okay. Thanks, G. Connected to kanina that you were talking about the breathing technique. Can you expand it a little further? Is it the same as the buteyko? Is it buteyko ba yun? Is that, someone asked it, is that the same breathing technique?
The deep breathing that I am aware of and that I really practice is the deep breathing from your diaphragm. You have to inhale it for 4 seconds and then hold your breath and exhale. I'm not really familiar with the technique, although I have to look into that yet. But the bottom line is deep breathing exercises. When you do that daily, it will really help ease your physical anxiety and your whole mindfulness experience.
If we turn it into a routine, G, what is the best time to do that? When you wake up in the morning, bago ka matulog, ano ba yung...
Anytime. You do it as often as you can.
Starting point.
Morning. Pwede morning.
You want to adapt it.
Morning, you start it. Kasi you wake up, then you start, make it a practice, make it a habit. And it takes 21 days to form a habit. Morning, if you want, then make sa afternoon, mag-physical exercise ka. Then before you sleep, you might want to do that as part of, sabi nga ni Mark, he got into the practice of meditation. It helped him. And that's the power of habits. So you may want to have that pattern.
Okay, so that would help out, no? Part of our routine.
Yep.
Okay, thank you, G. Mon, meron ako dito kasing private question na sinend sa akin, but you want to go ahead?
We have a lot of questions. Let me see. How about you, Doc Mark? Do you have anything right now?
Yes, po. Dr. Gia, we were talking about earlier. We were talking earlier about expressing your emotions, about talking about your concerns. But like for example, a lot of well, not necessarily within the profession, but a lot of people my age were stuck with their parents at home during the quarantine. And for some, that's already stressful. But what if, for example, po, the parents you're with at home is also your employer? So if you, for example, talk about things related to your profession, it's inevitable that some emotions might get in. And essentially po, your source of stress, you can't escape it that easily. So would you have any advice po for those who can, number one, escape their source of stress, and for those who can really talk about their stressors? Would you have any advice for those people po?
Um, um, it, it's very difficult when your family is your employer, no? But to that point, I think it's important to communicate your boundaries, both as a family and work. I know it's difficult to do that, but kailangan maka-establish talaga ng communication that work is work and that different yung family. Now, to the point na uh, yung family yung toxic, yes, that can happen. You might want to have a support group outside family where you can be more open. However, never also forget that at the end of the day, you will have your family back. So again, communication talaga is something that was really enhanced during this quarantine because you're forced to talk about the things that are not really that pleasant. Eh. And for me, dapat yun yung talagang ma-build. No? The the you have to verbalize what you need also. So that's my take on that question.
Yes po, thank you, Dr. Gia. So still talk about it, but make clear boundaries.
Yes.
Yes po. Thank you. Dr. Monica, Dr. Rochelle?
Actually, I have one question here. It's been asked several times. It's regarding the finances. So what is your advice on practicing dentists who lost valuable earnings or income during the pandemic that caused undue stress? Of course, I think it's for everybody naman. It's not just this. But we were one of the hardest hit, so to speak.
I'm not a finance expert though, but one thing that helped others, no, my friends who were on the same kami, was they had to find other sources of income also. So parang build on something that you might have wanted to venture in before. That was one practical move that I learned. But at this point, talagang we're all hit. So I think we just need to really extra save and just be careful and deliberate about our spendings. So that's my answer to that, Rochelle.
Thank you, G. Mon, we have time for probably 2 more questions, and for the panelists, unless our panelists have questions for Dr. G.
Yes, everybody have questions?
Just to add, I guess maybe all of us are struggling now. Just like what I think it was Jack Ma who earlier in the pandemic, he gave this parang he made this statement na just right now it's just really to survive, no? So we don't think of earning or turning in a profit for 2020 maybe. And right now it's just really as we mentioned earlier, taking one day at a time and just doing everything to just try to survive, no? And everybody's saying now we'll get through this and this will pass. The thing is, we don't know when will it end. That's uncertainty, but definitely it will pass. And I guess we just have to be, as Dr. Gia mentioned, we have to remain hopeful. And I think that's the most important thing.
Yeah, I will also add. For me, when the anxiety came in, the fear of getting sick, passing it on to my family, that's why I didn't want to go back to work. But aside from, needing to earn the money, the second reason was that my patients needed me. They were calling me. They were asking for me. May clinic ka na? May clinic ka na? Ang dami nang nagtatanong. And while we were doing the online consultations of UP Dentista para sa Bayad, there was a day we had 80 pending cases. They were all in pain, namamaga. everybody, the Filipino people needs us dentists to go back to work. And so we have to, suck it up and study na lang kung sino yung kalaban natin so that we know how to fight it. So that's why you really have to get back to work. Just that's your motivation, right? Okay, so any more questions from the panel?
Can I just add something? Okay. The other day I got a call from a patient, and this is something that I really appreciated, because it's a young executive, and he knows that I'm a senior citizen. So what I really appreciated was that they were canceling their appointment, not because they were fearing that they might have had some exposure, and it wasn't for them, it was for me. So it's really something that makes you feel good that your patients also think of you, no, that they feel that they don't want to get you sick. So in this way, since you're a senior, then they're more careful about it. And I just wanted to share it because it really made me feel so good. And for the seniors out there, as Dr. G was saying, and I really appreciate what I learned from her today. The anxiety is part and parcel of everything, and us being a lot of us have very strong faith. I think basically that's what we're holding on to now. For us seniors to be going back to work, I mean, we have to have strong faith and hope that everything will be all right. Thank you, and I really appreciate your talk, Dr. Gia.
Thanks, Doctora. Thank you.
Dr. Tristan?
Yeah, I guess that's it. No, we're into our new world. Ibig sabihin, no, parang it's a new beginning in terms of in terms of doing things, and I guess siguro to keep that mental well-being, we should be always on the side of preventing the spread of the disease, doing our part. Siguro pagka yung ginawa natin yun, I guess it will help us, yung mental well-being natin will always be there. Hindi tayo nag-iisip na we cause trouble or we cause something bad to other people. So we should do our part. We should continue to do service, practice the profession, and make sure that we don't spread the disease. We make sure that we do our part para mapagsilbihan ng ating mga kababayan. At the same time, practice the safe protocol. Sabi nga ni Dr. Gia, yung mga dating tinetake for granted natin, dapat gawin natin ngayon lahat. Isa puso natin. And thank you very much, Dr. Gia, for this particular very, very informative, very helpful. Maraming salamat.
Thanks, Doc.
Colonel? Colonel?
Doc Dia, thank you for the lectures and the advices. Pero pwede humabol ng isang question.
Sige po, Colonel, go.
What can you advise dentists who are called to augment medical practitioners in quarantine facilities to cope up with the anxiety that it's not part of their training, but due to the exigencies of the service, they are required or they are asked to help in the quarantine facilities?
Okay, ang take ko po dyan, Colonel, is just ensure that they're safe. May mga instances kasi talaga that lack of resources will lead to that. But the first thing that sabi nga ni Dr. Tristan, you ensure that you also provide a safety net for them if you're gonna deploy them. So yun po yung first step. Although it has to be voluntary. But if it comes to a point that they need to be deployed, then we need to just ensure that they are safe in terms of proper PPE and safe working environment as well.
On their part, personal yung pag-deal nila sa anxiety. How can they deal with it personally?
Okay. One practice po is to have a support system within your working system na pwede nilang takbuhan whenever they have questions or whenever they feel that there's something wrong with them in terms of the way they think and they feel. So yung mga hotlines po, they actually work. I've tried them myself. Yun po yung mga crisis hotline that can actually help. You might want to have something internal within you na pwede nilang tawagan, parang SOS
Okay.
when it comes to mental health. And that will really actually work. And that's one support system you can provide.
Okay, thank you, Doc.
Great suggestion, no, sir?
About Doc Ian. Doc Ian.
Sorry. Just like to thank you again, Dr. Gia, for your talk, and I guess everyone really benefited from all the advice that you gave us this evening. I personally self-affirmation, I think that's very important, and self-care. So I think all of us just have to be really, again, as I said, hopeful. Everything will work out. No, this will pass, and with all of this, I guess just like what Dr. Mon said, no, we have to be there, go back. I've been practicing for the past 3 weeks, seeing patients, and I think everything's working. I don't have any symptoms. So I guess just like what also Dr. Tristan mentioned, no, yeah, once na sasanay, umpisa talagang mahirap. We had to make a lot of adjustments. But yeah, after 3 weeks already back in seeing patients, I'm confident that I'm happy also that I'm able to help my patients as well. So thank you very much again, Dr. Gia.
Thanks, Doc. Thank you.
For everybody in Zoom, we share the link for online mental health consultations. It's on Zoom link. We will send it also on Facebook link. We need to wrap up. Our moderator panelists, Dr. Mon, Dr. Mark, help us out.
Well, thank you to all the panelists, and special thank you to Doc Gia for accepting a second invitation for our tea talk. I would like to actually turn it over to Doc Mark for if he has any last comments.
Yes, well, Dr. Gia, thank you very much. It has been really enlightening, especially regarding we focused on things which are not often talked about, like simple things we can do, such as hand washing, for example, for COVID-19, and the simple act of talking to someone and having someone to talk to can be very beneficial for our mental health. So thank you for shedding light onto those things, Dr. Gia.
Thank you. And thank you to everyone who actually joined us tonight. And we hope to this too shall pass, just like anything.
Thank you.
Thank you, Juan.
Thank you.
Thank you, Paul.
We have an evaluation form. Please fill it out so we can issue certificates for everybody. Mon, go ahead, please. Thank you, G.
Well, we've actually gone over time already, so I think Dr. Rochelle, do we still have time for our wrap?
Yeah.
Okay.
Sige. Are you okay? Thank you, Dr. Gia, for accommodating the UPDA twice. We're grateful to you for giving importance to the concerns of our profession. To our esteemed panelists, Doctors Tristan Ramos, Chico Achacoso Damatac, Ian Ermita, Colonel Urriquia, Dr. Marc Pilaspilas, Dr. Monica Quiambao. Did I miss out anybody? Thank you for an engaging discussion. I know everybody picked up something from your insights. And thank you everyone for continuously supporting the projects of the UPDAA. And because we are thanking you, we held a pre-drew a raffle. They will be receiving gift packs from Pascual Laboratories. And I just mentioned, this is Celine Angeles from AFP Navy, Sofia Espinosa from AFP Navy, Ainsley Yee from Manila Dental Chapter, Christian Noel Bugarin from AFP Air Force, and Dorothy Joy UPCD. Kilala ko pa. Okay. And lastly, we also, please don't forget to fill out the evaluation form to get your certificates. To our technical director, Dr. Jonathan Fadyalan, thank you for your assistance as always. And with everybody's permission, I would like to acknowledge the work of an amazing team of officers around me who work with much passion and dedication, who always endeavor to bring relevant projects. These are Doctors Monica Sison Quiambao, Jamie De Vera, Michael Mendoza, Jocelyn De Guzman, Marc Pilaspilas, Elch Barroso, Dr. Melanie Serra, Grace Gonzalez Martinez, our advisors, Dr. Junjun Clemente, Dr. Paul De Castro, and Dr. Chico Achacoso Damatac. Thank you to our quarantine. At sa ngalan po ng aming kolehiyo, ang Universidad ng Pilipinas Kolehiyo ng Odontolohiya, sa patuloy na pagsuporta sa aming mga proyekto upang maisulong ang aming mga adhikain, sa lupon ng mga dentista mula po sa Hukbong Pandagat ng Pilipinas, sa pangunguna po ni Colonel Eloseada, Lieutenant Colonel Cahote, at sa pangangasiwa ni Regent Angelica Torres, sa tiwalang inyong binigay, sa lahat ng bumubuo ng UP Dental Alumni Association, taus-puso po ang aming pasasalamat sa inyong pagdalo ngayong gabi. At muli po, mula po sa aming mga tahanan ng UP Dentista para sa Bayan, maraming salamat po hanggang sa muli nating pagkikita.
Thank you, everyone. Thanks, Rochelle.
Thank you, Dr.
Congrats.
Yeah, thank you, everybody.
Thank you po.
Good night.
Oh